suction, what we need to do is we need to place our patient into our lateral position, which is the recovery position. When we're testing suction, we need to turn it on to full. And what we need to do is we need to keep the tubing, and we need to see if it gets over 350 millilitres of mercury. If it doesn't, what we can do is we can check all the tubing and the yanker to see if there are any holes or if the valves aren't connected properly. So what we're going to do now is we're going to suction our patient. So what we do, turn it on, keep the tubing. And what we're going to do now is we're going to insert the yanker into our patient's mouth to no further than we can see. And what we're going to do is we're going to cover the whole of the yanker, and as we're withdrawing the yanker, we're doing it in a circular motion, only sucking as we're withdrawing. We don't suction for more than 10 seconds because this could lead to cause hypoxia, which could lead to dysrhythmias. And if there is anything stuck after suctioning your patient in the tubing or the yanker, what we can do is we can use the water provided to clear it out. And OPA, they are used to maintain the airway during ventilations. They range in many sizes, from neonates, which are these ones, to adult sizing ones. We need to measure the right OPA for our patient. So what we need to do is we need to measure the OPA from the lip of our patient to the curvature of the jaw. So just using this one for example, when we're measuring it we can see that it's too small. So what we need to do is we need to keep going through until we get the right sizing for our patient. So measuring this one, yeah, this is the correct size for this patient. Before opening the airway, we need to be aware that our patient is either conscious or semi-conscious, because this may induce vomiting when inserting the OPA. So what we need to do is we need to open the airway using either a head tilt chin lift or the jaw thrust. The jaw thrust is mainly used when we have patients with spinal injuries, but at this time any of them will do. So what we need to do is we need to do a head tilt of the patient, so that's opening the airway, and when inserting the OPA we need to angle it towards the soft palate of the mouth and to over the tongue. Once you can feel that it's over the tongue, you rotate it in a 180 degrees and putting it in until it's fully inserted. Just like the OPAs, they're used to maintain the airways during ventilations. These are used during oral trauma and when the teeth are clenched. Some contraindications when using an NPA are nasal obstruction or if the patient has a history of epistaxis. When measuring the NPA, we measure it from the nose of the patient to the earlobe. So as you can see, this is the right NPA for this patient. However, if we used a longer NPA like this one, this could induce vomiting due to being inserted into the esophagus and not the airway, and it can also cause hyperventilations, which could lead to hypoxia. So before inserting the NPA, we need to lube the NPA with a water-based lubricant. So this makes it easier for us to insert the NPA into the nasal cavity. So what we need to do is we need to make a head tilt chin lift, opening the airway of the patient. Now we need to insert the NPA into the nostrils, into the largest nostril. Usually that's the right nostril, and on this patient it's also the right one as well. So when inserting the NPA, we need to insert it 90 degrees to the patient's face and along the nasal floor. So if there are any obstructions or resistance, we just keep rotating until the NPA is fully inserted. Once it is, we need to check if there is an equal rise and fall of the chest to make sure that it's actually been inserted into the airway. But before I apply my collar to my patient, I just need to assess them to see whether they are intoxicated or have been drinking. and I'll just ask them some simple questions like the date and the time and if they know who our Prime Minister is, just to see if they have a 5 out of 5 mental status. So what I'm going to do now is I'm going to palpate the neck just to see if there's any C-spine tenderness. If there is, a C-collar will need to be applied. I'm also just going to check for any neurological deficits and any other underlying injuries that could be found. So now what I'm going to do is I'm going to ask my offsider to come and hold the patient's head. Once they put their hand on the head, they can no longer remove it, and this is just to make sure there is no other injuries could be caused and no movement can happen towards the head. So what I'm going to do now, I'm going to measure for the sizing of the C-collar, so I'm just going to measure from the mandible to the trapezius. There you go. So what I'm going to do now is just measuring on the C-collar, so measuring it up to about a regular, and it's already on regular. So what I'm going to do now is I'm going to slide the C-collar underneath the patient's head, making sure any clothing or hair is out of the way. Go. So just applying the C-collar to the patient. And what I'm going to do now is I'm just going to check their breathing and their airways, just like if they were the same as before the collar was applied. Okay, now I'm going to be taking my patient's blood pressure. Just before I do that, I need to oscillate the chest using the stethoscope. I'll just be listening for volume and clarity of her breaths, and just listening to the 4 quadrants of the chest. But first I just need to get my patient's consent before I do this. Can I do this and listen to your chest? Yeah. So what I'm going to do now, just using the stethoscope, just going to listen to the quadrant. So, excuse me. Okay, can you take a breath in and breathe out? Thank you. Stop here. Breathe in and out. And just again, breathe in and out. Last one. Breathe in and out. Cool, so it's nice and clear. Right, so now what I need to do is just making sure that this blood pressure is the right size for this patient. So I just need to measure the circumference, so just removing any clothing, just seeing. Yep, so it's more than the minimum and less than the maximum of this BP, so it's the right size for this patient. So what I need to do now, I just need to remove clothing that could get in the way. So just placing where it says artery on the brachial artery, just here, closing it, there you go. And just placing the dial on her clothing, just so I can get a good reading. And just before pumping it up, I'm just going to tell my patient that it's going to get a bit tighter. Right, so it's going to get a bit tighter as I'm pumping up. So, you placing the stethoscope on top of the brachial artery, just so I can hear the pulses. So I'm going to pump it up to around 140 millimeters of mercury. You ready? It's just going to get a bit tighter. Okay. Now what you do is you slowly open the valve and just let the air come out. So what you're listening for is the first one, which is the systolic, and then the last one, which is the diastolic. Alright, so her blood pressure is 120/80. So this is take the pulse and the respirate of my patient. When taking the pulse, there are many places that you can take it. You can take the brachial pulse, the femoral pulse, or the radial pulse. So when measuring the pulse, you should do it, the golden rule is you should do it for a minute, but for this demonstration I'm going to be doing it for 15 seconds and timesing it by 4. So before I take the pulse of my patient, I'm going to ask for their consent. Can I take your pulse? Okay. So what I'm going to do now is I'm going to find her radial pulse. Once I've found it, I'm going to put a hand to her chest and I'm going to time it for 15 seconds. Okay, so her pulse was 76, and I also took her respirate without letting her know, otherwise that would have disrupted her breathing, so her respirate is 14. This is oxygen, and before we attach anything to the oxygen bottle, we need to make sure that it is in fact oxygen and that it's in use. So there you go. So, and also on the regulator we need to check the Botox seal to make sure that it has a good seal between the regulator and the bottle for a good gas exchange. So what we're going to do is we're going to attach the regulator to the oxygen bottle. I'm going to use quarter turns to tighten. I'm going to tighten it to finger tight but not too tight. So now what I'm going to do is I'm going to open the valve and check the amount of oxygen. There's about half in the bottle. And what I'm going to do now is I'm going to check the valves and see the different flow rates of the regulator. Right, as you can see that there are different flow rates of the valves. So what I'm going to do now is I'm going to attach the tubing to the bottle and attach the mask to the patient's face. For safety reasons, you would put the oxygen bottle on the floor so it doesn't roll around, but for this video purpose, I'm going to leave it as it is. So now I'm going to pack down the oxygen. So I'm going to remove the tubing from the regulator and I'm going to remove the mask from the patient's face. I'm going to flush the oxygen, so I'm going to close the valve and I'm going to flush all the excess oxygen out of the regulator. There you go. And I'm going to remove the regulator from the oxygen bottle. Okay, so this is oxygen delivery. First we need to check the bag and so that there is no backflow into the reservoir. So what we need to do is we need to cover the open hole with our hand and squeeze so as I can feel that there is no backflow. So what I need to do now is I need to attach the mask to the bag and the reservoir. And now I need to attach running oxygen to the bag. Okay, and then turning it on to full, about 10 to 15. And this is just to check that the reservoir is filling up and making sure that there are no leaks and no holes. If there are any leaks and holes, we can get a new one. So what we need to do now is we need to apply this to our patient. Okay, so now I need to do a head tilt chin lift so I can insert an OPA into my patient. So what I need to do is I need to size it up, making sure it's the right size for our patient, putting it in, twisting 180 and putting it into our patient's mouth. Now what I need to do is I need to put this on our patient using the CE grip and ventilating every 5 to 8 seconds only once, ensuring that there is equal chest rise. If gastric inflation occurs, we can use cartilary pressure to stop it. And also we can use the MOANS acronym to make sure that our ventilations are effective. Okay, so this is bleeding management for controlled and uncontrolled bleeding. What I first need to do with the patient's consent is remove any clothing to expose the wound. And what I need to do now is I need to clean it with saline. So just washing from the middle to the outwards, making sure that no debris is washed into the wound as I do so. So what I need to do now is I need to pack the bandage using the 2-finger method. This ensures more pressure to the wound and for the patient. Also applying the gauze bandage to the top of this, causing more pressure to the wound, trying to stop the bleeding. What I need now is my offsiders to come and elevate the limb. Okay, so now what I need to do is I need to bandage. So going over the gauze and the bandage, just wrapping. As I do so, I need to twist. This ensures more pressure onto the wound. So keep doing this trying to put as much pressure onto the wound as possible to try and stop any bleeding. If the bleeding doesn't stop, what we can do is we can add more gauze and more bandages to the wound site, just to try and make sure that the bleeding completely stops. Okay. So if the bleeding doesn't stop, what we need to do is apply a tourniquet. So what we also need to do is call for backup, call for an R50. This ensures that we are given more adequate pain relief. So with a tourniquet, what we need to do is we need to apply it to a single limb and above the joint. So just putting it on here. And we need to make sure that the patient is aware of what we are doing. So as we do this, we slowly tighten the tourniquet. This should be able to stop bleeding. As we're doing this, we need to check the radial pulse. If we can't feel it, then the tourniquet is working. However, if bleeding continues, what we should do is we should apply another tourniquet superior to the one that we have just put on and proximal to the last. This making sure that bleeding stops. Fracture management, and I'll be splinting my patient's fracture. So what I need to do is I need to assess the patient, but first, with the patient's consent, I need to remove their clothing. So what I need to assess is the acronym PLUSTIS, which is the patient's pain or the loss of function in their limb. So what I need to do is cardiovascular and neurological integrity, so that's checking the capillary refill, the temperature and the colour on both, and comparing it to the uninjured limb. So what I need to do now is I also need to ask the patient what their pain scale is. If it's 6 and above, I would give the patient Internox due to it being a moderate to severe pain scale. I'm going to be telling the patient the contraindications of Internox. So the contraindications of Internox is if the patient cannot obey commands because it is a self-administered drug, if they have a suspected pneumothorax, if there is a suspected bowel obstruction, if they've been diving in the last 24 hours, and if they have a known allergy to this drug. If the contraindications don't apply to this patient, then I'll be giving them Internox and splinting their leg. So asking my offsider to come in and hold the injured limb for me. So now I'll just be splinting the leg, so if she holds it up, I'll be slowly putting the splint underneath the limb. So once the splint is applied, I need to, if there is any gaps in the splint, just adding some more padding so it is more comfortable for our patient. So what I need to do now is I need to bandage and use a figure 8 on the limb, on the splint, so it's more comfortable for our patient. So going over the splint, so can you just lift that up for me? Thank you. Going over the splint, just making sure it's comfortable for our patient. Going under. And as we're doing this, just keep reassuring the patient and just asking if they are on any other medications or anything. And what we need to do when applying these slings or bandages, we do it above and below the fracture site, just so that there is no pressure on the actual fracture itself, causing less pain to the patient. So keep reassuring the patient and making sure that the splint is nice and tight, also quite comfortable for the patient. So again, just going under. just making sure that the patient is feeling comfortable with the splint. And once we have put the splint on the fractured limb, again we do another cardiovascular and neurological integrity test. So again, that's checking capillary refill, checking temperature and the colour of the fractured limb, comparing it to the not fractured limb, just seeing if it is the same before you put the splint on.
Okay, so this is an ECG monitor. We need to check the power by turning it on. We can also change and check the batteries while we're doing this.
Connect electrodes.
So what we're going to do is we're going to put it in manual mode, so pressing advisory and going to manual mode and saying yes. We're going to attach the test pack. We're going to do a test. So we're going to go on, it's going to go on options and scroll down to user test. We're going to press that. Okay, so it's important to do this before every shift because we want to make sure that it has passed so we can use it. Cool, so it has passed. We're just going to rip this off and just put it aside. So what we're going to do now is we're going to choose our energies. So for this demonstration, I'm going to put it to 50. And we're going to charge. So what I can do is I can either press charge or I can disarm it by pressing this button. So I've disarmed it. And what we're going to do is I'm going to change through the leads. So selecting leads, I'm going to pop it on the 2, 1, 3 because usually we have a 3 lead. So this is a 3 lead right here. Just check, there's all our leads right here. And what we want to do is change the amplitude of this and the size of the waves. So pressing size, just going through the sizes. For this demonstration, I'm just going to select 1. Also, we want to change the volume. So pressing options, going down to alarm volume, selecting volume, and just going through to see which one you want, which one will work. So for this, I'm just going to put it there, about middle volume. And what I'm going to do now is I'm going to get the ETCO2 and attach this to my patient. So this is just checking my patient's SpO2 levels and their heart rate. When you're putting this on your patient, you need to make sure your patient doesn't have nail polish on because it could affect your readings. If we need to change the paper, we can just open the paper tray and just remove the old roll and chuck it away, and we can just replace it with a new one and just insert it just like this, pop it back in, making sure that it's in properly. What we can do is we can run another test just to make sure. Okay, so when you're coming onto the scene, you need to assess the dangers and check them just for yourself, your off-sider and your patient. Just now I'm going to check for a response, both physical and verbal. So I'm just going to do a clavicle tap. Hey, can you hear me? Hello? So I didn't get a response from my patient. So I'm just going to do a checking the pulse. As I'm doing this, my off-sider can go and get an R50 for this R49. So just checking the pulse for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, so I didn't get a pulse, so what I'm going to do now is just check the airway, just see if there are any obstructions. If there are, I can just clean it out. So I don't see any obstructions, so what I'm going to do now is I'm going to check their breathing. So look, listening and feeling for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So I couldn't feel any breathing, so I need my off-sider to come and start compressions. As she's doing this, I'm going to work around her and put the pads on the patient. 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. I'm going to do is I'm just going to
Analyzing heart rhythm.
stop, don't touch the patient.
Do not touch the patient.
Stand back.
Shock advised.
Okay, don't touch the patient.
Charging.
Just checking that no one's touching the
Stay
patient.
clear of patient. Deliver shock
Okay, everyone
now.
stand clear.
Press the shock
Okay.
delivered.
So you get back onto the chest
Pause.
and keep doing compressions.
Start
So I'm gonna
CPR.
put a OPA into my patient's mouth just to help with breathing and their airways. There you go. Making sure all my oxygen's set up. 24, 25, 26, 27, 28, 29, 30. And we're just looking for adequate chest risers, just making sure that our ventilations are working. So on the next round when this goes off, I'll swap over with you. So 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Very good, well done, Jess. Right, so I'm just going to ask a series of questions like, does anyone know the patient?
No.
Does anyone know what happened?
No.
And if anyone knew any history?
No.
Okay. 21, 22, 23,
Well done,
24,
Jess.
25, 26, 27, 28, 29, 30. I have my suction just on the side, just in case my patient does vomit, so we can just clean it up and then resume doing CPR. 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Very good, Jess. Well done. Twenty-three, 24, 25, 26, 27, 28, 29, 30. Just making sure that there's chest rise every time you do ventilations. Twenty-three, 24, 25, 26, 27, 28, 29, 30. Very good.
Stop
Okay,
CPR.
Tristan.
Analyzing heart rhythm.
Okay, we'll swap over.
Stay clear of patient. Analyzing heart rhythm.
Yep.
No shock advised.
Okay,
Pause.
I'm just going to go straight and do
If needed,
compressions.
start CPR.
5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29. 1, 2, 3, 4, 5, 6, 7, 8, 10, 11, 12, 15, 16, 17, 18, 19, 20, 21, 22, 23, 25, 26, 27, 28, 29, 30. If my patient does regain consciousness, what we will do is we'll log roll them, just rolling them over to their side, so we can just extract the OPA from their airway, and then rolling them back, just, keeping care and just putting them into the recovery position, just making sure that they're alright.